Hi, everyone. Welcome to the premiere episode of MedTech Minis. I'm here today with Ophir Ronan of CalmWave, and I'm so happy to have him with us today. He is one of my favorite startups, so I'm thrilled for him to be the first company to move forward with us. Tell us a little bit about your company and a little bit about you.
Thanks so much, Susie. I'm Ophir Ronan, CEO of CalmWave, and I'm honored to be here this morning. So with respect to me, I'm a veteran of enterprise IT operations where I've spent the majority of my career. And we too, in enterprise IT, have dealt with the problem of alarm fatigue at scale, especially in Fortune 100 companies. Taking that knowledge in combination with really fantastic clinicians, so we've got both the inside and the outside in terms of the industry, to solve this pervasive problem that has existed for decades. And that is the problem of alarm fatigue in ICUs. So hopefully you haven't had the misfortune of needing to be in an ICU, but if you have, there's a cacophony of noise there, right? That's the place you are in order to try to heal, or as in the case of a nurse, that's your day-to-day working environment. And when there's 80 to 99% false positives in those audible beeps, and patients generate up to 800 to 900 of those a day, so think about that in the context of 20-bed ICU, it's really hard to heal, and it's really hard to work there. So our job is to fix that foundational problem in order to also objectively improve nurse retention.
That is so fantastic. And I have to tell you, after being in healthcare for almost 2 decades, having loved ones in and out of hospitals, the alarm issue has been an annoyance for years and years and years. And I've been waiting for a company to come and solve this. I've seen many who have tried and have not, who've done an okay job, but not done it the way that it needs to. And I think that I want to hear a little bit about your solution now, because I think my understanding is that you can cut the time that nurses spend, which is usually about 2.5 hours a shift, down to about 2.5 minutes. Is that correct? And tell me how you're doing that.
Yeah, that's exactly right. So, I mean, if you think about the status quo today, there's academic papers that show in a 12-hour shift, nurses spend up to 2.5 hours or more of their time, mainly hitting the silence button for 1 to 3 minutes, which then comes back on again. And if you think about that, what we're doing is we're empowering the clinicians with an understanding of when it is a safe opportunity to make alarm limit changes. So right now, as a frame of reference to how bad things are, there's no APIs where you can talk to these bedside monitors and make changes to these settings. So our job is to build trust with the clinicians and physicians. And we do that by showing them why it's a safe opportunity to make a change. There's 5 safety gates that have to be true before we'll surface a recommendation, and the how, because in many cases, these devices are hard to use. And clinicians who are in the middle of caring for these really sick patients, they don't have time to call a tech to come in and help them make a change, which, it's just not worth their time. So showing them the why and the how in the interface and empowering them with that knowledge is what we do.
That's fantastic. And the thing I really like about this too is it fits right into their workflow. It doesn't have to change anything that they're doing. And then can you tell me, how hard is the learning curve on this? Is it pretty simple, or how long does it take for you to typically train a nurse?
Oh, we can train a nurse in it within, half an hour. Our training is comprehensive because we go through lots of different things, but these are smart people. And once you show them how to do it, it's a really easy process. So when we talk about 2.5 minutes of time, that's assuming that, they're able to implement these changes when they're already in front of the patient during a patient assessment in 30 seconds or less, and they're done. So
that's fantastic.
Yeah.
I love that. What else would you like people to know? I know you're on market now. I know you just got a big contract with a hospital system, which is fantastic. Is there anything else you'd like people to know before we head off?
I mean, I want people to know, and this is especially coming in as a industry outsider into healthcare, which is, a pretty big leap, that it is possible. And there is a lot of interest in healthcare for new and innovative solutions. And there's lots of charter account hospitals out there that are willing to innovate and are excited to innovate, assuming you have a solution that resonates. So don't give up.
Yeah, I am so excited about this, and I really want to see it in every hospital. My brother was in the hospital for about 3 months a few years back, and it was terrible. And, there's just the fact that it keeps them up at night. I know you guys also have a lot of research, and I know we don't have time to go into that today, but about how this impacts the pediatric patient population. So if anybody would like to speak to Ophir or anyone from CalmWave, how do we get a hold of you?
Yeah, so you can certainly reach out to us on our website, calmwave.ai. And then you can also send me an email, ophir@calmwave.ai.
Awesome. Thank you so much for being my very first guest. I love what you're doing, and I'm so honored that you would do it, on here with me, that you talk about it on here with me. Thank you so much, and have a great day.
The honor's mine. Thanks, Susie.